treat it early. Moving on to the next point, disability limitation. So basically in this you want to limit the disability. So like there is a disease and you want to make sure that you are, there is an impairment of something. You want to make sure that it will not turn into something like a handicap. So you should know this sequence. A disease can lead to impairment, that can lead to disability, and the disability can transform into handicap. Now, the major causes of disability you can mention here. They are like malnutrition, right? Malnutrition, diseases, communicable diseases, low quality of perinatal care, that you can put here itself, malnutrition, low quality of perinatal care, and disability can also be a result of accidents. So these are the major causes. So the thing here is, when you mention diseases, you can also give examples how leprosy affects the nerves, diabetes can cause gangrene of the leprosy, right? Diabetes can cause gangrene. Then you can have smoking that can lead to peripheral vascular disease, which all can lead to some amount of disability. Okay. So now one more thing you can add here is, what is impairment? Impairment is basically a loss or an abnormality of anything, the structure or the function is lost. Okay, it could be because of anatomical reasons or psychological reasons or even physiological reasons. So basically, loss of structure or function. This impairment can be permanent or temporary. Fine. And it can be visible or invisible. Obviously, if it is physiological, it will be invisible. And it can be progressive or regressive. And one impairment may lead to secondary impairment. So basically, one impairment can lead to secondary impairments also. Now, what is disability? Disability is restriction or lack of ability to do something within the normal range. Okay, and so you can use the word disability as restriction or lack of ability. This is the word you can use. What is impairment? There is some loss. Okay, disability is restriction, and within the normal range you cannot do anything. Now, handicap. Handicap is a disadvantage. Look at the terms you have to use. Disadvantage resulting from a impairment or disability. Handicap is a disadvantage occurring because of an impairment or a disability, and it limits or prevents the fulfillment of a role. This basically prevents fulfillment of a role that is normal. So you can again revise here. Handicap prevents fulfillment of a role, it's a disadvantage. Disability is a restriction where the person cannot perform any activity within normal range. Fine. Impairment is the actual loss of a structure or function. What is intervention also you can define here. We have already said this. This is you're intervening the usual sequence of the progression of disease. And intervention in disability. In disability, the intervention is, it can be social, environmental or medical. Earliest people it will be medical, after that it has to be social and environmental. So there are three aspects to it: medical, social and environmental. So these are the interventions in disability. Now let us talk about disability prevention. So disability prevention means you're going to reduce the occurrence of impairment. So what are you going to reduce? The occurrence of impairment, and also you will give it treatment, and you will limit the disability and prevent its transition from a disability becoming a handicap. The primary prevention is the best way. So now for disability limitation, what example you will give? Example for disability limitation is resting the limb in neutral position in polio. In case of polio, the limb should be rested in neutral position. Okay, so this is disability limitation.